everyone, good morning. Today we're joined by Dr. Todd Vento. He is our Medical Director, Infectious Disease Physician and Specialty Care Telehealth Services, as well as Sierra England, an RN, and Katie Marshall, a Critical Care Technician. Thank you three for joining us today. We really appreciate it. As always, today we're going to start with our case counts and go over what's been happening since the last time we spoke. The numbers I'm going to be reading are from yesterday, which goes over the weekend period, just so everyone is aware. So yesterday's reported weekend case counts are 2,244, which is up 740 from that same period last week. We had a total of 15 deaths, and our hospitalizations sit at 367. Our 7-day pause rate is 14.7%, and we've had 3 new breakthrough deaths reported as well. Since mid-January, 98.1% of the 683 deaths have been unvaccinated. And of the 6,026 cases in the past week, 89.5% of those cases have also been unvaccinated. Let's talk about that piece first. Dr. Vento, what is the current situation that we're seeing with COVID? What trends are we seeing in our hospitals right now?
Sure. Now, the biggest trend is just really relates back to how the virus is behaving. So it's all mostly Delta variant, which is much more infectious, spreads much more easily to others. And so because of that, what we're seeing is a rise in cases in the community based on having not only enough folks who are unvaccinated, but also not having our practices that we had before with regard to preventive measures such as masking and more strict adherence to social distancing and large gatherings, things like that. So as a result, we've seen a lot more hospitalizations, and this is no different than the rest of the country. If you look at places like Missouri, for example, sort of a kind of a hotbed example that I think we all really need to learn from because of how quickly Delta spread through the communities and into the hospitals and overwhelmed the hospitals once again. So in our hospitals, we're seeing the same situation where we've seen, and unfortunately, individuals who do have clinical risk factors, obesity and other medical problems, but they're younger by and large, because those are the individuals who have gone out and maybe aren't the ones who are older who've gotten the vaccine. And so they've gotten COVID, then they've gotten sick, then very sick, and then in the ICU and a prolonged hospital stay, if not worse. Some of them have died. So that's really the trend that we're seeing. And unfortunately, it's also at the similar situation to what we've seen before. But this time, we obviously have many more tools that we can address the situation, or should be able to address the situation better with, such as the preventive measures of vaccines and even some measures that we already know that really still do work.
And the CDC recently made the announcement, I do believe it was last Wednesday, that they recommended that even vaccinated individuals start wearing masks again. What does this change signify? And from an infectious disease perspective, what does this mean?
Yeah, I think it's really important to understand why the CDC makes changes. And in this particular situation, it was really in response to really several outbreaks, but one large outbreak in Cape Cod area in Massachusetts. And they looked at a place where there had a high vaccination rate in the local residents, but then a lot of tourist activity. And they had several hundred cases, 500 plus, and the vast majority of them were actually in vaccinated individuals. Now, that doesn't mean the risk of infection is really high with vaccination, because we don't have a denominator of all the people that were vaccinated versus the number that actually got infected. That's just signifying that most of those individuals were vaccinated. And in those vaccinated individuals, they actually checked viral loads in their nose. And what they found was the viral loads were the same as in individuals who had not been vaccinated. That was a very important finding. And just from one outbreak study, that led the CDC to say, listen, if you are vaccinated and you get a breakthrough infection, which we believe to be low risk, they don't have perfect numbers, and I can talk about that later, perhaps if needed. But the reality is that you can have a high viral load and you can spread easily to others, just as if you were not vaccinated. Now, the good thing is that none of them got severely ill into the hospital, because the vaccine did exactly what it showed it could do. And why it was authorized for emergency use was because it prevents severe COVID and hospitalizations, ICU, and death. And so that still works. But it was important that we learn that you can still get COVID and you can still spread it to others based on a surrogate marker of a high virus pharynx or your nose. And so that was a very telling finding. Hence, they went immediately to recommend that individuals who are vaccinated should actually wear masks, particularly in settings where it's easier to transmit, i.e. indoor settings.
I have started to see more people wearing masks around our community. I definitely think people are kind of paying attention to what's going on. So it's great to see that. And before we were talking about the trends, you mentioned treatments that we've been giving people, and I know that there's some shortages of medication right now. Can you talk to us about what's going on with those and also what those medications are for exactly?
Absolutely, and certainly a very concerning occurrence is watching that we're running out of medicines nationally. Some of the medicines that we use to treat hospitalized patients, and so we've switched to alternate medicines that have been also studied. But really, I think the most important thing to take away from that is that means that we have a lot of individuals who were not vaccinated, because vaccination prevents severe illness and hospitalizations. Once you get into the hospital, you can have a severe illness because you don't have antibody levels from vaccination that can actually keep you from overwhelming your body and organ systems. And so when that happens, we may put you on an antiviral medicine like remdesivir. We might put you on a steroid like dexamethasone or prednisone. And then if you're still having issues, we might go to these next level of agents that we really look at as these are immune system modulating medicines, which actually decrease the inflammation in your body that can kill you or cause worse disease, but it's caused by the virus. Well, we've now have a national shortage of the primary medicine that we've used for that purpose. So we have the other medicines, but we have run out. And all that means is that we just had too many cases throughout the entire country in our own communities that have required much more a higher level of care because they're sicker, because they don't have antibodies that could have been induced by receiving the vaccine.
I want to talk about the vaccine a little bit too. Yesterday, it was announced that 70% of eligible Americans have now received one dose of the vaccine. This is a month later than the president originally wanted to have this one dose milestone basically met. But what does reaching this threshold mean for the country and also Utah as a whole?
Yeah, I think it's important. I think, the concept of putting out a marker for like, hey, let's get to 70% of one dose in adults by July 4th is something that we do as folks who try to inspire others to get to a certain point. But the reality is we need to go beyond 70% anyway. So yeah, they're probably about 28 days too late on that goal. But nonetheless, we're making progress. And there is some evidence even in the last 2 to 3 days nationally that we have an uptick in vaccination. But, if you think about that, that's an uptick in vaccination that's in response to individuals now hearing again, oh my goodness, young people are dying. The hospitals are becoming more full. And we know this. We've known this for so long. We've known that the virus, how it behaves, and now the virus, because of not being able to shut down its replication, allowing it to proliferate in the community still, it has mutated and it has gotten to the point where it has a survival advantage. So now it actually can escape some of the monoclonal antibodies. It can cause much higher viral loads. It can cause much higher viral loads that go through the body. And so that part, I think, is just a lesson that I think we're learning over and over and over again. And what I'd like to draw attention to is that the vaccination ultimately is, this concept, it is in the spirit of a way out of this, but it doesn't take the place of common sense. And it doesn't take the place of masks and social distancing. And we still have to do those. And we have to do those even more now because we've got a much more aggressive virus that goes between people much more easily. And masks do work to prevent that. So I think one thing I would think is important for folks to remember is we don't do the either or. We like to do that as like, is it this or is it this? Is it this or is it this? Can I do this? Will this happen to me or will this? And the answer is, it's not either or, it's and. Yes, vaccines work to prevent severe illness. They weren't marketed or released for authorization to prevent infection per se, although there are data that suggests that it does prevent infection, but obviously not at the level that it prevents severe disease and hospitalization. Therefore, it is important to wear masks, meaning and. We need vaccinations, and we need masks, and we need social distancing, and we need common sense to not gather, particularly indoors in large numbers.
Do you recommend someone who has recovered from COVID-19 take the vaccine as well, or do they have enough natural immunity to fend off all the variants?
It's a great question. And just like all the other things that we've learned, I hate to use the phrase silver lining, but we have learned a lot about COVID, which is the best thing about this is that we've not lost this opportunity to make a difference and prevent other suffering and disease. And so what we have learned is that there's likely to be immunity from a natural infection. The levels of antibody response from vaccination probably higher in most of the studies, and maybe even more of a durable or sustained antibody response, so immunity that might last longer. The best data we have from vaccinations in communities where we've really looked at everything that happened in the outpatient setting and the inpatient setting is Israel. And there was a relationship with Pfizer for that. And so they've got some great data that shows that what antibodies do over time. The answer that the CDC answer for if you've gotten infection with COVID is you probably have some immunity, and when you're done with your infection out of isolation, you are eligible to get the vaccine. That said, there's certainly some clinical data to suggest that it would be reasonable to wait a little bit because the likelihood of you having antibodies at a good level would be several. Discuss with your provider as to when you get the vaccine, but the bottom line is even if you get COVID, you should still get the COVID vaccine.
Another question back to the medication really fast. Can you elaborate a little bit more on that? Is Utah and Intermountain hospitals running out or short of remdesivir at all?
Yeah, so not remdesivir and not steroids, but tocilizumab, which is what we call an interleukin-6 inhibitor. So it's IL-6. It works on a pathway in the body that prevents or stops inflammation that is triggered by the COVID vaccine, or sorry, by the COVID virus. And so really, we still have our remdesivir, we still have our dexamethasone, but we have shortages on the medicines beyond those two. And yes, we absolutely have shortages in Utah, just like the rest of the country. Now, we still have monoclonal antibodies, and those are used for individuals who are high risk for severe disease, but are not sick enough to be in the hospital. And so that program has been going on since really December. We've done several hundred infusions a month through Intermountain and actually with the state task force with other facilities as well. But I think, what I would emphasize is you can see what's happened here. We haven't got enough folks vaccinated to prevent severe illness. So we've now run out of medicines that we use to treat severe illness. The monoclonal antibodies, some of them have actually lost their effectiveness because the Delta virus, the Delta variant can evade some of the monoclonal antibodies. So we had to go to only certain combination monoclonal antibodies. And all of that means we're actually taxing our resources, our individuals who run those programs and staff those programs. And I think you're going to hear about that from Katie and Sierra here shortly. But I think it just gets back to the fact that all of that is preventable and probably about 97% preventable, if not higher. Meaning if you get the vaccine, get your full doses, and 2 weeks after that, you are pretty much immune to a severe infection. You might get COVID, low likelihood, but you won't likely get severe COVID and hospitalization and be in the ICU where you'd need these medicines that we are now running out of.
Got it. That makes sense. And I want to address really quickly the 3 breakthrough deaths that happened over the weekend. Can you talk to us about the rarity of these deaths and kind of put a more whole picture to us around what that specifically means?
Yeah, I mean, obviously, it's very sad to see that we have any deaths from COVID. Particularly sad to see that we would have that in individuals who actually took the measures to prevent severe disease. But the reality is that what we're learning about the virus is that, if you have certain things in your immune system that can be overwhelmed by an amount of virus, which the Delta variant, for example, has a much higher level of virus. So it's almost like having a castle and have it guarded by certain number of troops or soldiers. The more you have, the more things you have, the less like you're going to get a lot of damage to your castle. And so what we want to have is as many layers of protection as we can. Vaccine. Hopefully, you have a good immune system, you stay healthy, you stay fit, all those things will help too. Some of the folks don't have the luxury of that. They might have a weakened immune system, might have severe age. Maybe they didn't have as robust an immune response to the vaccine because of those underlying conditions. Therefore, they were still susceptible to not only COVID, but severe COVID. So this is why it's so important to not just think vaccination. That's critical for the long term. Let's stop this virus from proliferating, but most importantly, let's stop people from dying. Let's stop people from coming into the hospitals and overwhelming our healthcare teams. This is exactly what we asked for last June, July, August, all the way through December, etc. But what did we do then? We went to things like pushing for more mask use, pushing for social distancing, pushing for common sense on not gathering in large groups indoors. And that's really important that we continue to do that. And that's the biggest concern we have, is that we understand that we went for the vaccine as our home run, and the vaccine is an incredible gift that we were able to get, but it's not enough. We have to still take those other measures. And if we do both of those, we can actually prevent the vast majority, if not all, infections, if we all did all of those measures.
That's some great advice. And I want to specifically talk about hesitations really quick around the vaccines. We're hearing a lot that people are still a little bit hesitant around getting the vaccine. And one of them is one of the common themes is unknown long-term risks of the vaccine. Can you talk about what we do know with the vaccine, and also elaborate a little bit on COVID, like contracting COVID and those potential long-term risks?
Absolutely. Great question. I mean, unfortunately, the term long-term is the I guess we say the long pole in the tent, or the biggest question that we don't have the answer to. We'll have that answer when we have long-term data. But we do have fairly good safety data. If you think about, collecting data on individuals who were vaccinated as early as, say, early summer, late spring last year. So we have a year's worth of data on that. And that data is really good. I mean, the safety profile, particularly for the mRNA vaccines, is very, very good. And I think what we do know is that we have a fairly high percentage of individuals now who, if they get COVID, get long COVID type symptoms. And we're still only scratching the surface on what that's going to mean for those individuals, even 2 years out, 3 years out, 10 years out. So I think the safety data on the vaccines are as good as we've seen. I think, to get back to your original comment about vaccine hesitancy and maybe why people get to that point, I would say that, it's not that everyone is sort of this ardent all the way to one side, anti-vaccination. It's really not that. We have good data on national surveys that show that individuals would accept a national vaccine mandate, even by the federal government, even by civic authorities, because there's willingness to have that. But I think what happens is there's so much information circulating that there's a lot of misinformation. So not just I don't know the long-term effects, which is certainly a concern, but is it going to make me, infertile, or some of the other sort of more outrageous concerns. And I think what I would say is that it's really up to each of us individually to get as much information as we can, to get really at the information that is from the studies. And the studies show that these vaccines are very safe and very effective. And the rushing part is another thing that people say, well, it was rushed. And the reality is, it really wasn't rushed in terms of the science that was done, as much as the authorization and the release of it to the public in a public health emergency. And this is what happens. We think about what happened last February and March. We would have clamored like drastically to have a vaccine at our disposal, and yet we didn't get it. So now we have it, and I understand that people have to make their own decisions, but I would encourage folks to ask their doctors, physicians, care providers, talk to others who've maybe read more about it and actually have had it, and ask them for their experience, and then look at a variety of sources, in particular medical authority sources, to get your actual data.
I want to switch to the Delta variant and talk a little bit about some concerns that people have had with that. One specific question was around if it's more deadly, or what is the contagion of the Delta variant versus the other ones. Can you speak a little bit to that?
Yeah, I'll start with the contagiousness factor first, or the transmissibility. And so, folks, we've all gotten smart on, a lot of us are armchair epidemiologists, or, epidemiologists screaming at the TV nowadays because we've heard a lot of terms and we've understand things. So we really look at this reproductive number when we think of pathogens, viruses, bacteria, parasites, et cetera, and when they go into communities. And our original number that we look at is this reproductive number. So if a virus goes into a community and there's not a lot of immunity, they've never seen it before, there's no vaccinations, and it goes into a community. And we look at this number called the R0, or reproductive number, that says if one person is infected during the course of that patient's illness, how many others can we expect to be infected? And we really have the biggest fear for agents such as measles, so the measles virus. And because that can infect up to 12 to 18 people per one person. And imagine I infect 12 to 18, and each of those 12 to 18 infects 12 to 18, hence huge outbreak really fast, which is why we have mandated vaccinations for measles, mumps, and rubella in our country and other countries, because they're very effective. But we have to get to almost 97, 98% of the population to have effectiveness. With the virus that happened in Wuhan and the immediate change in Europe and then New York and our country thereafter, we're looking at a 2 to 3, maybe a little bit higher reproductive number. So meaning one person gets infected, 2 to 3 others get infected during the course of the illness. Now with the Delta strain, we're looking at probably up to 5, maybe up to 8. And that's why you've heard recently this concept of saying it's as infectious as the chickenpox. And so for those of you who are not older, like some of us, we used to be told, hey, Johnny has chickenpox down the street, go over to Johnny's house, hang out for a little bit, and you'll get chickenpox. And that's exactly how I got chickenpox, and my sister got chickenpox. We went over to somebody's house and we got chickenpox. And then, that way our parents could plan on when we got the chickenpox. Well, now if you think about it, Delta variant is almost as infectious as chickenpox. And we have an effective vaccine for children for chickenpox, which is also required. And so I think that's the critical piece. Is Delta is a game changer. It's much more infectious. It spreads much more easily. And we have typically treated viruses like that with mandated or widespread vaccination use to prevent that spread. We do that for chickenpox. We do that for measles. We now have Delta. It's like chickenpox. We really need to up our game on vaccinations. In terms of severity of Delta, a lot of different reports on that. There's no confirmed higher risk of death or higher risk of severe illness. However, there are data that have come out of the Centers for Disease Control documents, not necessarily in official reports, that suggest that there might be higher risk of more severe illness in younger patients based on some of the epidemiology trends that we've seen in our hospitals. And I will tell you from anecdotally talking to our providers in our system that they have, called and said, hey, Todd, I had a 20-year-old who was obese and had no other risk factors, and he died in our ICU from this Delta strain, and 30-year-old and 40-year-old and 50-year-old. Now, part of that's because the 60, 70, 80-year-olds actually got the vaccine because they could, and we gave it as early as December and January. And now what we've seen is the individuals who did not get the vaccine are the individuals, if they have a risk factor to, can get severe illness and get in the hospital. So we don't have, jury's not finalized on the severity of Delta, but it looks like there's a fair likelihood that it might be more severe than the other strains based on a lot of factors, in particular, the amount of virus that goes into your body.
That's good information. And I'm going to switch to our frontline caregivers just for a couple of questions, and then we'll go back to Todd at the very end of this. So Katie and Sierra, thank you so much for joining us as well. I really appreciate it. I'm going to have you both introduce yourselves to our viewers first. Katie, I'll start with you.
All right, my name is Katie Marshall. I am a critical care technician at Intermountain Medical Center in Shock Trauma ICU. As a critical care technician, we help patients with activities of daily living, we take vitals, and then we're also trained to place IVs, catheters, and assist during massive transfusions and rapid responses as well. I've been there about 2 years.
And Sierra, do you mind introducing yourself as well?
Oh, sure. Yeah, I'm Sierra England. I'm a registered nurse at Intermountain Medical Center in the Shock Trauma ICU as well. I've been there for the last 6 years. I was a tech before, and then actually last February, so about a year and a half ago, I graduated nursing school, and I've been a nurse on the unit ever since.
So Sierra, you started right before or right when COVID kind of started. So I'll start with you on this question. Sierra, how long have you been working with COVID patients? You mentioned you're an RN. Can you kind of explain how graduating nursing school and starting and with everything kicking off has kind of impacted your career so far too?
Yeah, so I actually started on the unit like a week after I graduated, so pretty back to back. And then I was in orientation until just about June. And then when I came off on my own, it was just taking COVID patients right off the bat. And I've been taking care of them ever since.
And Katie, what about you? Your role is a little bit different than an RN typically. Can you explain how you work with COVID patients and your daily rounds at the hospital?
Yeah, so we kind of just help out the nurses with our COVID patients especially. We help prone and supine patients, turn them. We do lots of their personal hygiene cares. Back a year ago, we had to open up a surge unit, and so we ended up coming over here and just helping out, take care of our regular patients while the nurses were over on our COVID side. Yeah.
And Katie, I'll direct this question to you just since we are having a chat, but can you explain what the atmosphere is like in your unit right now, especially as it seems like cases and hospitalizations continue to go up?
Yeah, I think everyone is feeling a little frustrated. As healthcare workers, we went through our big surge last year and cases kind of started to go down. It kind of felt like we were going to start getting a break from it, and now we're just seeing more and more cases again. So I think we're all feeling a little frustrated, especially where there is a vaccine and many of the patients we're seeing are unvaccinated. Or aren't wearing masks. And so when there's ways that people in our community can prevent that, I think we're all just feeling a little bit frustrated and overwhelmed and just worried about what the future could bring.
And Sierra, same question to you. What is the atmosphere like on your unit and as you work in the hospital right now?
Yeah, Katie definitely hit the nail on the head there, but just to add to it, I feel like there's a lot of uncertainty and kind of apprehension. Our numbers right now are basically looking like where we were last October, so we're already kind of ahead of schedule with where our cases were last year. And so I mean, school hasn't even gone back into session yet, so it's like, okay, we're already this bad, how much worse can we get? Like, how much worse is it going to get? We had to reopen up our surge ICU, which is regular hospital rooms basically for patients that we turned into ICU rooms. So we had to set up all the extra equipment, all the extra monitoring, basically everything that you would have in an ICU, but on just a regular medicine floor. And so I think there's just a lot of strain and uneasiness going forward.
I have a follow-up question to that as well. We've heard a lot that our hospitals are full, but it seems like we have a lot of nurses. It's kind of this perception. Can you kind of explain what staffing is like as far as beds? If basically we've heard if we might not have a bed, but we might have staff, and how you're kind of trained to do specific stuff. Can you explain that a little bit further?
Right, yeah. So our unit, shock trauma, is a 24-bed ICU unit. And so granted, there's other ICUs throughout the hospital, but basically every time we move a patient out, there's usually one or two in the ER waiting to come in. So it's just this constant patient shuffle. Right now we've been able to accommodate and have beds for everyone, but that's, going forward, who knows how bad our cases are going to get and how bad the numbers are going to get. So yeah, it's been interesting. We've had to pick up a lot of extra shifts just to help cover the floor and make sure that there's enough staff to even be able to work and take care of each patient. And the ICU for nursing ratios. So for one nurse, we take one patient if they're really sick and need a lot of attention and we can't leave their room, or at most we take up to 2 patients. So with a 24-bed ICU, plus with the expanding unit, we're having to staff between 18 and 19, sometimes upwards into the 20 nurses every single shift. And that's just our unit. That's not the rest of the unit, the rest of the hospital.
And Katie, this question I'll address towards you. How often are you hearing patients talk about regretfulness or are wishing that they got the vaccine? Are you still hearing people talk about the vaccine that are in the hospital that they don't want it to? Can you talk about that a little bit?
Yeah, definitely more recently, we have had a few patients who have express regretfulness and not getting. People don't realize how sick they can get, and everyone thinks that they're not going to be the one to end up in the ICU, but in reality you never know. So there have been a few patients expressing that to us recently. There are still some who are very against getting the vaccine despite being very sick, but we just are encouraging everyone to get vaccinated and help prevent coming to the ICU and getting sick in general.
And I want you to elaborate on that a little bit, Katie. I'll do this one for you first. Do you have any messages to those who are watching this, who are still a little bit hesitant about getting the vaccine or haven't received it yet?
Yeah, I know it can be really hard right now, just with all the information out there. It can be hard to navigate what is true and what isn't. So I would suggest just talk to your doctor and figure out if the vaccine's right for you. I would really recommend getting it. It can help you prevent from getting to the level of sickness where you need to come to the ICU. It's going to help slow the spread. So if you're still unsure about it, talk to your doctor and go from there.
And Sierra, do you want to add anything to that as well?
Yeah, I would just say that I think at the end of the day, we all just kind of need to remember that, it's not like we're not on different sides of like some opinion or, whatever it is. Like, we're all going up against like the same common enemy, which is COVID. And like all of us want the same end goal. Like all of us just want to be able to go and run to Target without having to wear a mask and just like get back to regular life. And if vaccines and wearing a mask again is going to get us closer to that, then I think we just need to remember that like what life looks like if we all contribute, and it's going to be a group effort. Like we can't do this alone. It's going to take everyone.
Yes, that is very true. And I appreciate both of your opinions and getting some perspective from our frontline caregivers. So Katie and Sierra, thank you so much for joining us. I'm going to ask a couple more questions to Dr. Vento before we wrap up for the day. Dr. Vento, school starts in 2-3 weeks, depending on where you live. I'd love to know what your recommendations are for those who are under 12 to keep themselves safe.
Yeah, well, first of all, just incredible gratitude to Katie and Sierra and everybody who's working just exhausted from what they're doing and now have been doing it for 18 months. So I'm just so grateful for all that they do for our patients and for our other staffs and keeping morale high. You could see the positive messages, even though they're actually, under the gun, as it were, and suffering really, but still, chugging through it. So thank you so much. The thing I think is important to hear is this: school's coming back. And I think Katie and Sierra also alluded to it. Fall's coming back. So flu's coming back. Last year, we had record low flu and other respiratory viruses, record low. If you go back in 50 years and look at these, status on flus, you'll see this incredible, people will think 100 years from now, oh, what happened in that year? Well, everyone wore a mask and socially distanced or locked down and stopped going to concerts and things like that. And we lost all of our flu and all of our RSV, respiratory syncytial viruses, and our other respiratory viruses. This year, we're not masking. And not only have we have a much more aggressive Delta variant, that's spreading faster and more easily. People are getting sicker, and we're not focusing on masking and social distancing. And you can see what that is a recipe for. It's a recipe for disaster. And this is meant to alarm folks. It's not meant to alarm folks to the point of panic. It's meant to alarm folks to sort of wake everyone up to say, it's coming. This is our opportunity to reset our mindset to say, get the vaccine, absolutely. That's our long way out of this, long-term goal to get out of this. But we have to continue to do those other measures. So let's take it back to the kids. We have people in this country under 12, and Utah has the highest percentage of under 18 in the country. And we are not vaccinating those individuals because we can't yet. Hopefully we get that by December, January. That's what we're looking for if you look at the latest data from Pfizer, et cetera. And there's already good data that's come out for that. But that population is a reservoir for infection. They get COVID. Fortunately, they don't get severe COVID in high numbers, but they get COVID. And you're going to have them together every single day, and they don't have the opportunity for vaccine. They have to wear masks. So if I'm a parent, I am a parent. Fortunately, my kids aren't in that age, in school age right now. However, I would put a mask on every single one of them. I would still look at other measures to try to limit disease transmission, because now not only do we have kids and all the things that they have in schools and what they spread every year, but now we have a virus that spreads almost as easily as chickenpox. We wouldn't do this. If this was a chickenpox outbreak, we wouldn't allow that. But that's why we really need to not allow that for the Delta variant. We have to have masking of individuals in schools, and they really need a mask mandate and a universal mask mandate for children in school in particular. That's an indoor gathering. That's like hanging out in a bar or a restaurant for 8 hours a day with no mask on, while the Delta variant will jump from, in one person, will go to 8 people, probably in that scenario, it will go to even more people. So I think that's critical. And if anything, the reason why you should remember the vaccine, the masking, the social distancing, even hand washing is really, and we sort of fell off hand washing. Now we don't even talk about that as much. And the reality is that prevents the transmission of many viruses, many other bacteria, and that has to continue because we are coming around the corner for fall and flu season. And we don't need to have COVID Delta variant bouncing around very easily in schools where there's no mask and no vaccines. You see this recipe? That's something I really think we have to wake up to and think of doing doing vaccine and mask and social distancing and all the measures that work. And then we can look at where we are to try to get back closer to normal. But it's really critical that everyone take personal responsibility, parents, individuals, and use the measures that we know now commonsensically and with great scientific data that actually work.
It's interesting you brought up the other viruses and stuff that circulates during the fall. I thankfully have not been sick at all since the start of COVID, which I attribute to the fact that I've been wearing a mask. I normally get 2 or 3 colds a year, and it's pretty incredible that I haven't gotten those this year. So it's pretty great to see that it is actually working for other things besides just COVID as well. And something I really wanted you to talk about is the impact of these spiking cases are having in our hospitals again, in regards to the volume of our ICUs, and if you're concerned at all about that. I know the girls touched a little bit about the ICUs, but from your perspective, is there a concern that we're going to get past the capacity that we're able to have?
Yeah, and just put bluntly, we already are past our capacity in functional bed capacity in several hospitals, and not just Intermountain. And the reason why I bring that up and I'm glad you actually asked that question, is that we have these sort of sterilized reports on beds and beds at referral hospitals, COVID referral hospitals. We have a network of excellent communication that Intermountain has a big part in that, where we have a transfer center that can look at all the availability across organizations to figure out where is it best to put a patient who now can't stay at, say, a small community hospital because their nurses are overwhelmed, because usually they take care of 1 to 2 patients in an ICU, but now they're having to take care of 3 to 4. That's a huge difference. And so we have to move those patients. And so I am concerned that we focus on, when we present these capacities based on how many literal physical beds there are versus how many functional beds. You can't have a bed with no nursing staff, no respiratory tech, no ICU assistant care providers taking care of an individual in that bed. And we are already at and beyond functional capacity in several of our facilities. So that's not exaggeration. Those are just the facts. And what have we not had yet? Flu season, respiratory virus season. And you can see where this is going. It gets back to my earlier point that we have a lot of opportunity to make a big difference in what's going to happen in the next 3, 6, 9 months, but we have to do it now. You have to really get out there and get folks to try to get the vaccine, give them the information they need, but also encourage not vaccine or mask. Anyone who talks about vaccines are better than masks or masks are better than vaccine, they're missing the point. We have a toolbox of a bunch of tools. Let's use every single tool in that toolbox. Let's not just take out the screwdriver if we can use all of them in many different ways. I really think it's critical that people not forget about the measures that work. We don't want to wish our way out of this or hope our way to the finish line. We want to do the things, do the work that gets us to the finish line, and then we can actually celebrate, be proud, think of what we did together. And I love the fact that it was stated earlier that we have a common enemy. That's the only enemy we need to fight, the virus. And we know how to do that with every tool in our toolbox.
Dr. Vento, is there anything else you'd like to let our viewers know heading into this first week of August before we take off for the day?
Yeah, I think it was already commented on in some ways previously, and I understand that there's so much frustration. I'm one of them. I'm frustrated as well. But I think that to try to focus on looking at what we know works and trusting in the science. I mean, you can read about it. It's not even a mystery nowadays. You can go online and find the studies that are published that show the data. And that's what the Centers for Disease Control, the World Health Organization, and others put out. Those are the sources you should be looking at. Okay, you shouldn't be looking at television shows, doesn't matter which one, or television news per se, to try to make a decision about what the data show. You can look online and find the data yourself. And there are fantastic data about masks. In widespread use of masks can prevent transmission of all these these respiratory pathogens, and we have to do that. And so if you don't know the answer and you feel like you can't find it, reach out to your healthcare provider team, call your clinic and say, can someone talk to me about what the real data is? I'm confused, but at least reach out, but don't just take it from a source from any internet or any TV station. Get the actual, sort of horse's mouth. Go seek the truth, get the truth, and then you can feel informed, empowered, and make the right decision.
I love that. Go talk to your doctors. I think that's definitely the best advice if anyone has any questions about the vaccine or anything related to COVID. And Katie and Sierra, really quick before we take off, do either of you have any last words you'd like to say to people?
I would just encourage people to go get vaccinated, wear your mask when it's appropriate. We're all in this together, so if we want to make it through, we're gonna have to work together.
Yeah. And I would just add and say, like, just do your research. Like, really look into things and actually, like, form an opinion versus just taking, what's on social media and going off of that. Like, actually look into, like, the science behind it and things like that, and just, like, educate yourselves a little bit more. I'm like, why wouldn't you want to add on just an extra level of protection just to kind of give you that extra safeguard more than anything? So.
Perfect. And I appreciate all of that as well. And if anyone who's watching would like information around COVID-19 or the vaccine, they can go to intermountainhealthcare.org/COVID vaccine. You can also go to the state's website at coronavirus.utah to have great information as well. Thank you, Dr. Vento, Katie, and Sierra for joining us today, and have a great day, everyone. Thanks.